Hello and welcome to this week's episode of Jing TV. Today we are going to talk about the Jing Fix in 6 method. Yes, how you can get results in 1 to 6 weekly treatments with your clients. Stay tuned.
Action.
All right, here we are. The Jing Fix in 6. Let's put our money where our mouth is.
Yeah, absolutely. I think, so the Jing method has completely developed over time. I think one of the things people came to courses at the Jing Institute, and then other people call up and go, I want a Jing massage. And we were like, a Jing massage?
What is a Jing massage?
And then we started to realize that actually we have put together something that is quite unique. So it's called the Jing method, and it's a fusion of advanced techniques that Rachel and I both felt like work best in our practices, elevated us as massage therapists, and made us much more efficient in getting people out of pain. So the different techniques that are involved in the Jing method are...
we remember it by a mnemonic, don't we? HFMAST.
Yeah.
So the first technique that we use is at the beginning of a treatment, we use hot or cold for acute or chronic pain.
And then F, so we use fascial work, so we do lots of myofascial work involved.
Both direct and indirect techniques. M stands for muscles, and in our case, actually trigger point work and treating all the muscles around the joint for trigger points.
Yeah, so trigger points really, I think both of us feel like really changed. It was the first thing that changed our practice and made it something that was much more efficient. So when somebody came into the clinic with pain, and they gave us their pain pattern, we could say, right, well, these are the 4 muscles it might be coming from. So HFMAST, we've gone through hot, F for fascia, M for muscles. A is the inclusion of acupressure points, which both Rachel and I studied as actually our first port of call in massage therapy. So my first course I ever did was in shiatsu, and you did ama.
I did, yeah.
And so we involve putting in Eastern practices into our teaching protocols.
S stands for stretching. The work of Janet Travell around trigger points taught us that we should always stretch the muscles after we've treated them for trigger points.
Yeah.
So we put stretching techniques towards the end of the session, towards the end of the protocol. And we teach lots of different methods of stretching. So static stretching, PNF or MET, muscle energy technique, which are 2 very similar techniques. Active isolated stretching, and actually recently we've also started to include fascial stretching and something called functional stretching, taught by a guy called Lederman, who you'll see in other episodes.
And I guess also, soft tissue release can be put in that category as well as one of the things that we use. And then staying in our HFMAST idea, T, last letter, which stands for teaching, and that's really important. That's teaching the client how to do self-care exercises. I'm usually stretching, but also just like a little discussion around their pain. And I think one of the great things about being a massage therapist is that you get the time to offer that kind of information to your clients. And in fact, that is a huge empowerment purpose, where that doesn't happen a lot kind of in a normal medical framework, because they don't get as much time. I'm not a big fan of putting down GPs or putting down the medical industry and saying, they should. It's like, well, they don't get an hour with clients, and we do. So really the teaching part is really, really important. So Fix in 6 is really kind of a development of doing an HFMAST protocol dealing with different pathologies.
We should probably explain the actual Fix in 6 bit as
Sure.
well, shouldn't we? So the idea is that Meg and I felt that after training in lots of different techniques, that no one technique by itself consistently made a difference with clients. So if a client was coming in with low back pain, it wasn't that trigger point therapy worked every time, or stretching worked every time, or just telling the client to go off and do stretches for themselves, worked every time. But actually, if you included lots of different elements within a treatment, we were more likely to get better, quicker, faster results. Hence those elements of HFMAST that we've come up with. And I think it bears saying that we've learned lots of techniques that never made it to the mix. So not all the things we've trained in we felt were clinically effective in practice in terms of getting results. So the fix in 6 idea, and of course we don't promise to fix, that's not something we do as massage therapists. It's just handy that 6, rhymed with fix. But we do aim to reduce pain quickly and easily for clients, and we aim to reduce pain or increase range of motion significantly by the 3rd weekly treatment.
Yeah, 3rd or 4th, right?
Yeah, definitely. So what we say if someone comes to us in pain is, if you come to me once a week for up to 6 weeks, we should start to see a decrease in your pain after, week 3. I'd be expecting, maybe not a total reduction in pain, but some kind of significant result.
To just know you're going down the right track.
Yeah, absolutely. If you're not getting, if I say to my client, if I'm not getting that after 3 weekly sessions, I'll be looking to totally change what I'm doing, adapt what I'm doing, or to refer you on to somebody else who I think might help you better.
And that helps clients feel like they are on a pathway where they're going to have some change. So we're not saying come indefinitely to get treatments, and maybe something will happen. And this really changes people's practice who come to the Jing Institute for training, because whereas massage perhaps previously might have been taught to them as a relaxation element, and people come and get a luxury, this really moves them into therapy. And in fact, when we started teaching, we were doing these individual protocols for different areas of the body, but then we realized actually a foundation in those techniques would be really supportive. And as our lovely graphic designer has made me say, show them, Megan, show them where they can find it. And so this is the course, if you ever get one of our brochures. It's called the Foundation in Advanced Techniques. And it's for people who've been in practice for a while, who really want to understand those core elements. So trigger point therapy, myofascial release, which we've been teaching for many, many years. Stretching, deep tissue and forearm work. Also how to save your body. And then the Eastern approaches. And all of that happens in 3 days. So that if that's something that's interesting to you, you can join us on one of those courses. Rachel and I teach those about 5-6 times a year. You can find them at www.jingmassage.com.
If you can't get to a hands-on course, then the DVD is downloadable from the website.
That's true, right.
So all of those techniques.
We have a she's so smart. There's a whole DVD, and you can download the whole DVD, or you can go into sections, right? So you could just look at the myofascial section or the trigger point. That's in our shop. But also dialogue with us about it. If you want to know different things about different techniques, you can get on our Facebook page, ask some questions, or on Twitter. And then, of course, you can also train yourself on our online low back pain course and really understand the Jing method. So we hope to hear from you. Ask us questions, and we will do our best to support you along your Jing journey.